sometimes, honestly, when you're giving a massage and they have low back pain, because of the way they have to lay, a lot of times they get up and they're still in pain. And then I always tell them to take a walk because it helps integrate that new change. And then also I let them know it should feel better when they wake up the next day, and if it doesn't, then they should maybe see a chiropractor or someone to adjust the hips. So QL work, I like to use my thumb. I never go very deep unless they love it. There's some crazy people out there. I'm not one of them. I like just medium. So I'm gonna brace my thumb at up against here. My fingers are just kind of out here as supporters. I'm pinning down here with this hand and I'm peeling it away. Is that pressure okay? Mm-hmm. When you get to the 12th rib here, it attaches to the 12th rib, and the 12th rib can be really, really tender. So you want to be real careful when you get here. So I lighten up a little bit, kind of do a full stroke. And I think she can handle a little bit more pressure. So now I'm going to use my fingers. Is that okay? Mm-hmm. And I'm going to do a little bit of vibration. I'm moving this way, but rocking this way. The QLs are kind of interesting too because they crisscross like this instead of just this. They're like crossing. So I like to just wiggle that. There's a passive QL release where you lift up the opposite hip towards it and then you go in real soft. And sometimes that helps soften it. So if you guys are finding it super wiry and not letting go, try lifting the other hip and then doing your work. And sometimes it's even this hip that needs to come up. And that almost works better for her. And you can just tell it's like softer tissue, like it's not kicking me out as much. And you can even do both sides right after each other. This feels nice sometimes.
That feels excellent.
And we aren't going to do too much trigger point stuff because you'll learn all about it in NMT, but for right now, just some vibration and friction. Get the job done. And then I do like to do a lot of you can even do some cross hand stretches stuff like this. And effleurage to kind of bring it all back together. And now I'm going to show you, there's not a whole lot of gymnastics to do on this side, but there is some yummy back of the arm stuff. So when we do the arm series, it's all face up, but I'm going to show you guys the shoulder part of this series. So I'm just going to bring her arm out gently. Now on these tables, they have those little nubs that they sit on one side, so you just want to make sure their arm isn't on that. If that makes sense. So if I show you
legs.
Yeah. So I don't remember if your guys' table has those, but if they do, you just want to make sure if you're right over it, because if somebody was up higher, if she was up higher and her arm came over and down, I would protect it like this with my hand and just when I do my pull. So for gymnastics, we're really just kind of, it's like the arm pull series is what it's called. We do it on the front too, but basically you're just kind of lightly putting traction. Does that feel okay? Mm-hmm. And you can even do some traction all the way down. So this is where you would want to protect it if it was on that nub, because as you pull down like this, it's going to stab right into that. So just something to be aware of. And I like to do little circles, and I even like to kind of crunch the hand. For more gymnastic stuff, you can even bring this arm up so it's out, and you're kind of pulling on it, and you're gonna come down, or up, I guess, and around. And as you move the arm in, it's natural for the wrist to want to turn inward like that. Does that feel okay? And you can drop it here if you wanted, if it feels comfortable, and you can really work the rotator cuff, but it is going to be more tender in this position because all the muscles are elongated. If somebody really likes to have their arm up above their head like that, and that's how they want to lay, because some people are so tight, like they want to lay like that, you can bring a stool over. It's too high. Where's my thing? And you can just, I'm going to show this, you can rest the arm on this. It's not high enough now. Where is that thing? There it is. Like that. And you can help them just, if they both wanted both their arms and they just want to lay like that, totally fine. And this is just how you'd probably want to support it. Some people don't want to support it and they just want to feel their arms hang. So it's just a little tip or trick if you notice that when someone gets on the table, they're just like this instantly. Sometimes they don't know what to do with their arms, so